Hi, this is Angela Heath, and this is the final part of our three-part series on the caregiving market and the CARE Act. In the first video, we talked about caregivers, who they are, what they do, and what they need. We ended that video talking about the massive caregiver market and how many growth opportunities there are. I mean, it's absolutely tremendous. In the second video, we talked about the CARE Act itself and why it is so critically important for caregivers. And so in this final piece, we're going to talk about the implications of that act for both the caregiver as well as the hospital. So let's start with the caregiver. Why is this act so important? In order for caregivers to maximize the benefit of this act, it actually involves some discussion prior to the older person being hospitalized. So the family, the caregiving family, needs to come together and make some decisions about who is the best possible liaison with the hospital. And we've got a couple tips for doing that. First of all, they want to select someone who is going to be available. Sounds simple, but oftentimes family members, because of many different reasons, may not be available to be the liaison with the hospital. So you need someone who is available. You also need someone who is an advocate, who's not afraid to speak up, someone who will ask the important questions until they have understanding. It's important that that liaison with the caregiver be on one accord with the older person, because as long as that older person is still cognitive, the decision about their life truly belongs to them. So you want to make sure that this liaison, the caregiver who's been identified, will be a person who works in concert with that older relative. And finally, I want to give you the tip to make sure that that caregiver who's been selected will be able to perform those home health care tasks once they get home. So they should be able to recite back to the doctor and the nurses what they are to do and to demonstrate proficiency before that older relative goes home. So those are just a few of the tips that caregivers can implement in order to make sure they maximize the intent of the care law. So what about hospitals? How can hospitals really benefit from this opportunity? And I use the term opportunity because that's exactly what it is for hospitals. We offer this self-assessment tool that hospitals can use to really get a feel for how caregiver-friendly their operations are. And once they get that assessment result back, then they can begin to implement low-cost, easy-to-implement strategies that will help them be better positioned within the community. So not only will the caregiver feel, if you have to go to the hospital, mom, you want to go to XYZ hospital, but all of the other members of the family will feel that way also. So this act, although designed for caregivers, it really is a great help to hospitals because it furthers their opportunity to become patient-centered, and that's what the American consumer is looking for. So let me give you just 3 tips on things that hospitals can do that will be very helpful to not only their bottom line, but also to caregivers. One is that they can offer caregivers, as soon as they arrive and they've been identified, a self-assessment. This self-assessment is a quick, easy self-assessment, but it will help the caregiver begin to understand at the very beginning what are their strengths and what are their weaknesses. It will position them to better work hand in hand with the hospital to make sure once that person is discharged that they're able to carry out the instructions. So do a caregiver self-assessment. Number 2, demonstrate the kinds of tasks that person will be responsible for while the older person is still in the hospital. If the caregiver can support a nurse in some of the tasks that she or he is doing, they will feel more comfortable once they return home. And then third, develop those much needed resources within the community. Many hospitals have home care agencies or relationships with occupational therapy organizations, but I want to encourage them to strengthen those relationships, because these are the supports that will be in the home implementing the discharge plans and helping that caregiver to do the tasks that they need to do. So those are just a few of the things that we would recommend for hospitals and for caregivers. There are many more. And if we can help at all with implementation of the CARE Act or understanding the caregiving market, we would be happy to do so. This is Angela Heath at www.angelaheathspeaks.com. I look forward to speaking with you really soon. Thanks.